So I had a patient this week, 6 providers that she had seen for the same hip pain. 6. She'd been to a chiropractor who told her that she had a rotated pelvis, a massage therapist who blamed her psoas, an orthopedist who wanted to do injections, and an acupuncturist who said that her chi was blocked.
Let me guess. A PT who said her glutes weren't firing.
Are you psychic?
Some people say.
Well, then she found us. And you know what? None of them were necessarily wrong. They just weren't right for her.
Mm-hmm. And she probably found every single one of those through a 5-star Google review or her neighbor's recommendation.
Exactly. And so this got us thinking, how should you pick a provider? Because the way most people do it is basically healthcare roulette. And today, we're giving you the cheat codes.
This is the pitch.
What happens when a chiropractor and a physical therapist get together to make a health and wellness podcast?
But chiropractors and physical therapists don't like each other.
Oh, think again.
I'm Dr. Kathy Lynch, physical therapist who likes to help people move and get stronger.
I'm Dr. Jason Young, an evidence-based chiropractor who uses humor just as much as adjustments to help people get better.
Welcome to the Pitch Podcast.
Remember, there's no I in pitch. Okay, folks, we're back at the, what is this? We're at the Pitch Podcast. There it is. Yes. I'm Dr. Jason Young.
And I'm Dr. Kathy Lynch.
And we are the Pitch Podcast. Mm-hmm. Yes, we are. So welcome back to another week. We don't know why you're still here.
Hey, we are.
Yeah, I guess so. I guess that's a good reason. If it's your first time joining us, welcome and thank you. And go ahead and subscribe. Subscribe now, before you hear what this is. Yeah, because then maybe you'll forget that you just already subscribed, and it's like, perhaps you're tired then. And it's like, you know what? I already subscribed. Maybe I'll unsubscribe later. And you won't.
While you're still listening, subscribe.
Yes. While you're still listening, definitely subscribe. So, and we also would appreciate a like. Mm-hmm. Although we're not doing this for you to like us.
No.
Sometimes we're giving you some hard facts and truth.
Yes.
A Google review would be great. No, a Google review? No, that's what we want for our business.
Yes.
Like, we want reviews on like Spotify,
yes.
UB2B. Leave a comment.
Comments.
Or whatever.
We want comments. We love feedback.
Comments. We want feedback, but it's also just fun, right? Like, even if you disagree with us, just tell us.
We would love that.
Yeah. Or like, hey, we hate you. It's like, oh, thank you for listening.
We have nothing but love for you.
Yes, you're amazing. So. Yes. So here we are again for another fine episode of high quality entertainment-based health information.
Here we are.
Disclaimer time.
100% entertainment.
This just totally entertainment.
Not healthcare advice.
Yeah, we're absolutely healthcare professionals, but we do this show for fun.
Yes.
So, talk to your own doctor. Speaking of which, we want to talk about how you find your own doctor.
How do you pick?
It's hard.
Doctor.
Yeah. Well, and these days I feel like sometimes it just gets picked for you.
It does.
Yeah.
Yeah.
Like your insurance company.
I'll ask patients, like, who's your primary?
Yeah.
Don't know.
Yeah.
They just gave me somebody.
My primary what? Yeah. Well, and like the local Medicaid insurance, they literally do that. They give you your card and they give you a name, and that name, that is your primary care doctor.
There you're going.
Yeah. It's insane.
Mm-hmm.
But hey, we also have choices in healthcare because this is not Canada.
No.
Yes. And so you get to pick the providers that you want to see, ifing you can get out and actually see them.
If you can.
Yes.
Ifing.
Yeah, ifing. That is a verb. Settle down, Raul. We're killing him over there. He's dying. Ifing you can get out and see the and see the doctor that you want, then you can get in and see him. So let's talk about this episode. We're going to talk about some white flags, some red flags, and every other kind of flag in between. Can you rely on your friends to give you a good referral? How do you pick the right provider for you? Okay. So first of all, there's no consumer reports for doctors, is there?
No, I mean there's those health grades out there, but
health grades
that is generic and they're not regulated.
No,
so people can write whatever they want.
Sure, and yeah, I don't think I've ever personally gone to health grades. I think the only time I might use health grades I think mostly just because I don't want to read stuff about myself.
Yeah, I do not. I do not. I gotta tell a real quick story. At one of the clinics I used to work at, we had a disgruntled intern was asked not to come back, and he went to our Google reviews.
You went
And
to town.
but his Google reviews were hilarious.
Oh, were
I
they?
wish I would have screenshotted them.
Oh, man.
But the two ones that I remember were the water is watered down there.
Even the water's watery.
The water is watered down. Number 2, it smells like Arizona in there.
What?
Exactly. And he had a whole list. He just went through like 10 of them.
He let you have it, both barrels.
He let it both barrels. And if you're out there, Tiger, please send me your notes. I don't work at this clinic anymore. But let me tell you, the owner of this clinic became unhinged.
Oh, I believe it.
And got Google on the phone.
Hey, listen, if you're accusing me of giving out watered down water, we're gonna throw hands.
Anyway,
so funny.
so yeah, health grades, Yelp, Google reviews, unregulated.
Yeah, they completely. And it's interesting too, because reviews in general, you're either gonna get really, really good or really, really bad. My experience, 90% of the really, really bad.
Yeah.
If they were writing an honest review, it's I didn't want to pay my bill.
Yes.
So let me tell you how horrible these people are. So yeah. And I have a friend who goodness got a terrible review, just the worst scathing, right?
Yeah.
Like accused him of like legit misconduct and everything. The poor guy, the person wrote the review for the wrong clinic. It was a clinic that had a very similar name, and it was just like, and they knew it too.
Oh, it was the wrong clinic.
Yeah, so they got a scathing review for not them, and they know that it wasn't them because they named the doctor, and the doctor is at this other clinic. Not, and so it's like, oh shoot,
that's a bummer.
And did I ever tell you about the worst review I got?
No, I would like to hear this.
So I get like when you have a business, you'll get little notifications. You've received a review on Google, and so I got like a 2-star review from a patient. I knew who it was, and I went and I read the review because I was surprised because it's somebody who like we like and got along well. She was getting good results. So I go and I read this review, and she's like, Body of Health Chiropractic and Wellness Center is the only it's the only place where I would trust with my healthcare, like to take care of my back. And, the massage therapists are great, and the doctor is smart and he's handsome. Okay, that's not actually what it said, but it was along those lines. It was an awesome review.
Okay.
2 stars.
What happened?
That's a great question. So when she came in next, I was like, hey, first of all, thanks for leaving a review. That was amazing. Like, thanks. It was such kind things. I do have one question, which is, what would it take to get that 3rd star? Because
it sounds like we were doing pretty good.
Yeah, you really set the bar high. So she's like, what do you mean? And I was like, yeah, you gave us 2 stars. She's like, I didn't give you 2 stars. I was like, well, how many stars do you think you have? She's like, I didn't see any stars. So she just didn't even know that the stars were a thing, right?
Yeah.
And so she had selected 2 and just submitted the review, which was a very nice review. And so I was like, well, I don't know. Like, I don't want to tell you what to do, but maybe you could go and change it?
Edit the star.
Yeah. She's like, oh, yeah, totally. So she gets out her phone. She can't figure out how to log into her Google account. Just standing, I was stressing for it, and I was stressing about it, but I was like, oh, wait. When people are going to go somewhere, they read the best reviews and the worst reviews.
Yeah.
My worst review was pretty freaking awesome.
Yeah, absolutely.
That was great. So
Boy,
it's like,
even at his worst, he's had some.
Oh, a win is a win. Yeah, right? A win is a win. So, yeah. But so the reviews are kind of tough. And if you're new to an area or you have a new problem, you need a new type of provider, like let's say that you finally decide to trust a physical therapist. Which, can we talk about your shirt real quick?
Please.
It says physical therapist because Rockstar isn't an official job.
I got this free at a conference.
Oh, nice.
But I like to rock it around the office.
You are working that shirt.
Am I? And it's
very good. Yes. So, yeah. So if you decide, hey, now it's time for me to try out XYZ, like, what do you do to find somebody? Now, this is kind of hard to answer
Yeah.
because we don't have a normal path
No.
anymore
Mm-mm.
because we have extensive networks of healthcare providers. And so
Right.
we're going to ask around, probably get some good advice. But what we want to talk about today is what do we tell patients in terms of how to select somebody?
Mhm.
So, um, yeah, what do you think?
Well, I thought about this in a different context too. People will ask me for like suggestions on where they should go and what to
Hmm.
do, and I generally when I'm and I think this will lead into our larger conversation. When somebody asks me that, I usually know the patient. I've known him, a couple visits at least, and then the people that I'm going to refer them to, I might have a couple. So if they're asking me for a massage therapist, there's, so many massage therapists in this town, and there's some, I know better than others. So when I'm trying to give the referral, I try to match the people with
Mm.
like, does this person like to,
This
be
person likes pseudoscience.
yes.
No.
Does this person like someone who's gonna talk them through everything they're gonna do? Or does this person just want you to do it? Stop talking, more working,
Yeah.
kinda thing, and so,
Mhm.
I think the important thing that we'll talk about is you kinda have to match your healthcare what kind of healthcare you want for yourself with the provider who's gonna provide it, because 'cause we're
Absolutely.
not all equal, and we're all different.
All different in a good way.
Yeah,
Right. And
yeah.
it's great. Well, and then the flip side of that is like just I think last year the rules in Oregon changed for chiropractors where if you are going to fire a patient, like meaning
Mm,
they can't come back
yeah.
anymore, you're now required to give them 3 referrals to somebody else that they could go see for their problem.
By law?
Yes.
You
And
could get or
by rule.
by rule,
Yeah.
okay.
Yeah. And so
Wow.
yeah, so basically, I have to figure out the 3 chiropractors that I hate the most in the area because I got a patient who, like, I don't know, they wanna threaten staff
Yeah.
or, they don't show up for their appointments or something like
Mhm.
it's like, "So who do I like the least to
Okay.
me?" I know, yeah,
Corvallis
so
Chiropractors, you're on notice.
yeah, I know, so I am so sorry if you get a referral from me and, yeah, just, hey, send me one back. We've all got them. Send me one back. It's all good. Real quickly
Mhm,
though, just in general, when people are looking for healthcare,
mhm.
let's talk about how do you find somebody who really is what they say they are?
Ooh.
Like, what's the difference between somebody who's licensed or certified or
Mhm,
credentialed? Like, what are your
mhm.
thoughts on that?
This question kinda came up in our clinic the other day because we were gonna hang up our licenses.
Hmm.
Yeah, and really, we don't need to hang our licenses anymore.
Yeah, they changed that rule for us
Yeah, the
too.
rule
Hmm.
is as long as it's available via the internet,
Yeah,
if you go to your state board,
the internet
the
or
interwebs,
AI. No.
AI, yeah. If you go to your Oregon State, um, Physical Therapy Licensing Board,
Hmm.
you can search a person, by name
Hmm.
and check their licenses, and you can see, if their license has any red flags on it too, if they have had anyone complain about them, that rose to the level of the board,
Yeah.
giving them a warning or
Which is probably a little more useful than it's like, "Oh, look at that frame." And it's like and you can dust the frame all you want,
correct.
and it never
Yes.
shows you if that person has,
Yeah.
like, hurt a patient or
Right.
something like that.
Right.
Yeah, I think
Yeah.
they changed the rule for us for that same reason, and
Mhm.
so
Yeah.
but yeah, it used to be a rule. In fact, I remember when I was on the state licensing board, man, I dinged more than a couple of chiropractors for not having a current license displayed.
Display.
So
Yeah.
I remember when we first talked about changing that, I was like, "Are
Oh,
you kidding me? Like, of course you have to
you
display it."
must.
But yeah, listening to some of the logic and reasoning behind it, it's like, okay, first of all, nobody's looking at those.
No.
Nobody, right? If you look at mine has said Dr. Kobe Bryant, DC for years. For years. Yes. Dr. Black Mamba, right? Uh-huh. No. But
So
yeah, so yeah, sorry, go ahead.
yeah, you go to the licensing board in your state for the providers that you're looking for. The medical board in Oregon will show the doctors that you're looking for and
Mhm.
show their continuing education, the alphabet soup that's after their name.
Yes.
Do they really hold a fellowship in such and such? Because you can put
Right.
anything on your website
Mhm.
that you want,
Absolutely.
but your state licensing board will have that listed.
Totally. And that is an important thing because we take for granted
Mhm,
when people put it out there. And this is an issue these days, especially like on social media,
mhm,
that you'll have influencers and you'll have providers of different kinds, and they should be identifying what kind of provider or doctor or therapist they are.
mhm,
Um, and so that's in general, and also I think it's more specific too, because even medical doctors, people are like, "Well, I'm a medical doctor," and blah 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 blah, blah. And it's fine, which is good. That's what they should be doing. But if you are a gastroenterologist,
mhm.
I don't know that I really want your opinion on like eye pain,
No.
right? And
Right.
so it's good. I guess if we're getting into flags a little bit, so providers who don't disclose what kind of provider they are,
Mhm,
a little bit of a flag.
mhm.
And then it's also important to know the difference between a certification and a license.
Right.
So if you have a certification, that means that you have completed a course of study.
Mhm,
If you have a license, that means that there's oversight and regulation.
mhm.
And certification can't be taken away,
Right.
right? Like I'm ART certified,
Right.
right? It's like the ART people aren't going to show up and be like, "You're doing a bad job with patients. Give us your certification back."
Mm.
No, because I paid them $2,000 to put the ART at the end of my name, and until that expires, I got what I
And
paid
you
for.
keep paying so you can stay on their website.
Exactly. It's advertising. Like, that's essentially what is a certification is.
Yes.
It's advertising that you have completed a
You
course.
have a skill.
You have a skill. And a lot of these programs, I'm gonna call it a hustle. It's not a hustle, but the hustle
Mhm.
is, "Hey, come back and take our super expensive classes, and we'll tell everybody that your certification's
Mhm.
up to date."
Mhm.
But it's just like, "Oh, wait, you're teaching me the same thing that you already taught me
Mhm.
again and again?" So,
Mhm.
that's why I don't have a bunch of letters after
Yeah,
my early on in the career, I was chasing those letters.
absolutely.
But then it's like, "Man, you guys are hitting me for like $750 a year,
Mhm.
and I can still just do all the stuff." So,
Yeah, and if you have a license, that means you had to pass the licensing exam,
yes.
and you are held to a certain level of care
Mhm.
and rules,
Yes.
laws.
Yes, laws, statutes. Right.
Yes.
Mhm.
If you abuse a patient, your license will be taken
Yes.
away.
Yes. And you no longer have the privilege to continue doing that thing. If you have a certification, that could be taken away, and you might still have the privilege of doing that because there's no oversight.
Yeah.
So, for example, common credentials that you will see after somebody's name, which means that they're licensed, is like, well, let's start with the two biggest ones,
Mhm.
DC
Yeah.
and DPT,
That's right.
right? Those are probably two of the most reputable ones out there.
Most reputable,
Not
most revered.
Yeah, not far behind, you have MD, DO, right? And what do these letters mean? Okay, DC is Doctor of Chiropractic,
Yeah.
DPT, Doctor of Physical
Yeah.
Therapy, MD is Medical Doctor,
Mhm.
DO is Doctor of Osteopathy. There's LMT,
Mhm.
Licensed Massage Therapist, which is a license. It
Mhm.
it takes a year to get. You have to do a year of training, but it's a
And then
license.
they
It's not
pass
a
the
certificate.
licensing exam.
Exactly.
Yeah.
And that is an industry though where you have a lot of certificates and things like that. And
Mhm.
so if you want the good stuff, go to a licensed massage
Mhm.
therapist. ATC, which you know what that one is?
I don't
It's
is that
athletic
like
trainer.
I thought that was
Yeah.
like the four-wheel
Yeah.
the three-wheel ATV.
Yeah, your athletic trainers, right? That is it is a postgraduate degree.
Mhm.
There's internship, there's certification that has to be maintained, continuing education. Um, like well, then you get into some that are there's LAC, right?
Yes.
Licensed
Mhm.
acupuncturist. What else is there? Oh, DDS. Let's not forget our
That's not our
dentist.
favorite.
Yeah.
healthcare provider.
Yeah, quacks. DMD also.
Mm,
Well, and the difference between a DDS and a DMD, functionally nothing. It's all about, this is what I understand, not
okay.
a dentist.
Yeah, I don't know these things.
Yeah, but it's all about the degree that the school that you went to
Oh,
offers.
offers.
Yeah.
Okay.
And these days, an MD and a DO are essentially the same thing.
Mm,
DOs will have a little more of a musculoskeletal focus.
mhm.
They learn, excuse me, they learn manipulation and things like that. But they go through all the same training
Right.
that an MD
Right.
does. See what else is out there. Like podiatrists, do they have a separate name? I don't know. I don't think so. But like a lot of these other specialties, they're still MDs and DOs. Like if you're an ophthalmologist, which is different than an
Yes.
optometrist,
Right.
you know,
Definitely.
you're going to be an MD or a DO.
Right.
And so looking for those things and understanding, like if you see letters after somebody's name, Google it. That you can Google, right? But it's important to know because it's not to say that somebody with a certificate is going to do a bad job, but they're held to different standards. And like if you're out there and you're putting MD after your name, somebody's going to come after you if you're
Yes.
not really an MD.
Yes.
You're going to do some time.
Yep.
Yeah,
Yeah, that one's illegal.
that is illegal, right? So yeah, those are important things. Make sure that who you're working with is actually an expert in that
Mhm.
field or licensed in that
Mhm.
field. Um, is there a certain quantity of letters that you should be looking for after a name? I know you think at least 5 because you gotta have the PT and the
And the
DPT,
DPT,
right?
yes.
hmm
It depends. If again, it depends on what you're looking for. If you're looking for a special surgeon, you likely like a brain surgeon, neurosurgeon, you probably want them fellowship trained.
Yeah, absolutely.
Yeah.
And so I
They
don't know what
probably
all
have
those
to be
letters are,
fellowship
but
trained.
there's and I think that that's something that you can
Mhm.
typically find on a website.
Yeah.
They're going to tell you about their
Yeah.
fellowships, which a fellowship is just extra training.
It is extra training. Yeah.
Yeah, it's like I went and for a couple more years of my life,
Yep.
I spent it learning about how to do left wrist surgery.
Exactly. Yeah, in the PT profession, there are fellowships and then there's also certifications. Like you can be an outpatient certified PT.
hmm
You can be a sports certified. That's the SCS, sports certified PT. You can get vestibular certification. The fellowship is there's residencies and then there's fellowships, and again, like you said, there's more training. So fellowship is the way that it's been described to me. I actually thought about going back and getting my fellowship in manual therapy because Amy McDivitt is a fellow, and I decided, well, if she did it, I want to do
You're like, hello, fellow.
it. And then I looked at all the
You would have
training.
been her fellow.
Yes,
Yeah,
I would have been.
yeah.
Yeah, I was
Mhm.
like, I
But
can't do any more
but
schooling.
you're like Dunzo.
So it's more
Yeah.
so you're still practicing as a PT when you're getting your fellowship, but
Mhm.
you are doing more training, you're doing more research into evidence-based practice. You're also being mentored directly by another fellowship trained PT.
Right.
And so you're getting a lot of hands-on mentoring, and it's usually takes, I think it's like can be a 2-year program. And so then you have to pass a lot of tests.
Yeah.
You have to do a lot more testing, but then you're fellowship trained.
Sweet.
Yeah.
Well, and chiropractors, we're just now dipping our
Mm.
toes into the fellowship
Oh,
waters. I
nice.
think there's a couple out
Yeah.
there that exist. A lot of what you'll see with chiropractors is diplomates, and so there's a few associations, like national level associations, and they will come up with these diplomate programs, which are like several hundred hours of
Mhm.
training
Right.
in those. And so I looked at like, oh, do I do a diplomate? And
Mhm.
but I decided instead to do a master's degree just because I felt like that carried more weight.
Mhm.
Not a lot of people know what a diplomate is or even that they exist. And so it's like, if I get a master's degree, everybody understands
Yeah.
what a master's degree is. And
Mhm.
so So those are just kind of the things that you want to look for after people's names.
Mhm.
Um, and yeah, more letters doesn't necessarily mean mo better.
It doesn't. And I mean, in the PT world, and I don't want to rag on these certifications like sports certification or orthopedic certification, but in our profession, you study for and then you pass a test and you are certified.
Yeah,
If you're residency trained, that's a different story. And then, because the residency, you spend a year in residency with mentors, and again, you're kind of drilled into the evidence based practice. Then you sit for your certification.
yeah.
So you can get your OCS, you can get your SCS without having a
Hmm.
residency. People that get their residency now, it's just basically one more year where you're working full time, but also studying full time and being mentored.
Yeah,
But it can, for new PTs, it can kind of set your trajectory, give you like a 3-year boost on your experience.
cool.
Yeah. So
Yeah,
people that are residency trained, um, those are good PTs. I'm not
yeah.
residency trained. It doesn't mean I'm a worse PT,
You're
but
a good PT.
I
You're
appreciate
a
that.
very good PT.
Appreciate that.
I'm
But
proud of you.
oh, thank you. I needed
Yeah.
that today.
Well, and I think one of the things that's hard is how that translates over to patients
Mhm.
because,
Yeah.
like, it's hard because they don't know. It's like
Right.
I worked my butt off for this.
Yeah.
Yeah, you know how
Do
much
you
gray hair this
know?
cost me, or hair
Yes.
period, right? So,
Yeah.
um, well, and so with chiropractic, I will say that there is one diplomate that probably rises above all the rest in terms of significance, and that is called a DAC bar. It's a
Mm.
diplomate of radiology.
Mm. Oh,
So,
okay.
and they've actually studied this. They've measured chiropractic diplomates in radiology versus radiologists in terms of their skill in reading like X-rays and things like
Mhm.
that, and they're pretty darn close. Pretty darn close. I would say that a radiologist gets more reps,
Sure.
and so that's good.
Yeah.
But these DAC bars, like it takes several years to become a DAC
Wow.
bar, and they work in imaging centers and
Mhm.
things like that. So that's pretty cool.
Yeah,
Then you have
that's
the
good.
other end of the spectrum where we have some weird ones that are actually pretty controversial and not always really helpful. For example, there is a certification called a chiropractor or a functional neurologist.
Ah,
Yes.
yes.
And so this is a little misleading
Mm.
because the public hears functional neurologist.
Mhm.
You're a neurologist?
That's amazing.
Yes, it does not take the same level of commitment and effort to become a functional neurologist and a neurologist.
Okay.
And so,
An MD.
yes, exactly.
Okay.
So, like, for example, um, part of my master's degree is in functional
Mm.
medicine, and it's a term that's been hijacked. And I think that to put it in a way that kids understand, if you like functional dot could seemingly be replaced by Timu,
Mm.
right?
I love
So it's
Timu, by
like
the way.
I was like, "Oh, you're a Timu neurologist," right? So yeah, and so that's kind of problematic
Mhm.
because it's like functional neurologists, they are interested in the brain, the nervous system, things like that. My opinion, they need to find another term
Yeah.
because it is confusing to patients. I had a patient who came in very serious concussion, went off, saw the functional neurologist, got a diagnosis that literally nobody had ever heard of. I'd never heard of it. Right. I've seen lots of concussion
Yeah.
patients. And so the state requires you to have a level of training and certification in order to like return athletes to play after a concussion. If you're, if not just if you're a chiropractor, but if you're anybody who is not like an MD or a DO. And so I have some training in this diagnosis. I was like, what is that? Called up an MD friend of mine. I'm like, "Have you ever heard of this?" And they're like, "No, because it doesn't exist." And so it's like, okay, like what is this,
Yeah.
right? And the biggest concern is that the patient thought that she was going to a neurologist. And I'm taking my notes and
Yeah.
everything, and I was like, "Oh, okay, you're seeing a neurologist." And I was like,
What's
"What's
the
the name of your
doctor's name?
neurologist?" And I'm like, "That's a chiropractor." So
Oh, shoot.
So, yeah, so it's kind of buyer beware on
Mm.
some of these certifications and
Mhm.
everything, but, you can dig into that.
Mhm.
Um, okay, well, So we talked a little bit about
Yeah.
certifications. Just to jump back to the reviews,
Hmm.
what are some things that people should be looking for, do you think, in reviews? Like what's okay, what's good to look for in a review, and who can you rely on in terms of not just a review, but even a referral?
Hmm.
What do you think?
Well, again, I think it goes back to what's important to you
Mhm.
as a patient. For me, I want a healthcare provider who listens,
Mhm.
but is also kind of no nonsense in the sense that they're not going to give me fluff.
Yeah.
They're going to say, uh, for example, my cardiologist, I beg her every year, can I please have some estrogen?
Mhm.
She says to me, she said to me, she's like, you escaped death once. Would you like to try that again?
Like,
And
I'm trying to
so,
cheat death every day with a little estrogen. No.
I highly appreciate that.
Mhm.
She just broke it down for me. She didn't like try to sugarcoat it. Like,
Yeah.
this is why she said, yes, you cannot have this unless you would like to
Right.
try to die again.
It
So I think it's important to know what you want.
sounds like a James Bond movie.
Mhm.
Try to Die Again, starring Kathy Lynch as James Bond.
How about just a little bit of estrogen? So anyway, I think it's important to know what you want from a healthcare provider. Do you
Mhm.
want somebody who, is going to chat you up, is going to ask about your kids, ask about, your spouse, things like that? Or do you want somebody who's just going to give you medical advice?
Yeah.
So know that.
And that comes through in
Mhm.
reviews
It
sometimes.
does.
And you're looking at the type of reviews. If and this is not to bag on front desk staff or anything like that, but
No.
some people will leave a great review for a clinic or something like that because they have a great relationship with the front desk staff,
Yes.
which is not bad, but it
No.
doesn't tell you anything about the type of care
Hmm.
that you'll be getting there
Hmm.
from the provider.
Right.
Um, and the other thing too, I think is a flag when you're looking at reviews, look for evidence that somebody is out there buying reviews. Like if you see the same exact review over and over and over,
Mm,
I'm gonna suspect that's not a real review.
right.
Also, if you see somebody left a review and they're like, "Hey, the people at so and so clinic are great. Sure hope I win those basketball tickets."
It sounds like
It's like,
trying to hit
okay.
something off there.
Mhm.
Yeah. And if you see like 5 Google reviews on one day,
Yeah.
questionable.
Yes. In fact, Google will tell you it's
Yeah.
questionable. Oh, geez. And can I just say, don't use Yelp. Yelp is
Yeah, that's
garbage.
kind of old.
Yeah,
It's kind of 80s.
it's 80s, and they manipulate their
Mhm,
review system,
mhm.
and I think that they do it just so that they can get businesses to pay to advertise on Yelp.
Yeah.
Like, it's crazy. Good reviews, bad reviews, every once in a while, they'll just be like, "Yeah, that's not a valid review."
Mhm.
It's like, "Wait, what?" And every time I've gone to them, they're like, "Well, you know what? If you just advertise with us, we'll make all of your reviews good reviews." It's like, "Okay, right. That's shady." So okay.
Eh,
So let's talk about like good signs, bad signs. Like what are maybe some everybody wants to hear the bad stuff. So what are some red flags whenever it comes to providers and what people should look for? Like what do you look for as a patient? Also, what do you look for whenever you're thinking about referring to a provider? What's a red flag for you?
I get a lot of feedback from my patients about doctors that they see,
Okay.
physicians that they see, and there's one particular that, I've heard it a couple times now. They go to see this physician, and this is he's the product of this system that we're in,
Mhm.
and they have said to me that they go into the visit, and he doesn't make eye contact because he is just writing down, he's typing what they are saying. He asks them questions, but doesn't look at them as a patient, and just writes down what
Yeah.
they're saying and asks follow-up questions, and the only time he looks at them is when he's saying, "Oh, I'll prescribe you this," or this is what you should do, and that's the end of the conversation. So that's a red
Ouch.
flag.
I think that is a red flag. I mean, that says that maybe he either doesn't want to listen or isn't comfortable,
With that.
like, with you as a person.
Yeah.
Yeah, I mean, I just don't know what to read into it, but yeah, I think
Yes.
that's a bit of a red flag.
Yes.
Yeah.
So, I am taking notes while at my visit with my patients
Mhm.
because the system is I have to submit these notes to
Yeah.
get paid.
Yeah.
So, but don't hide behind the computer.
Yes. Well, and I think before we dig any deeper into this, I think you bring up a really important point that there are providers and there are systems.
Yeah.
And all providers have to function within a system.
Mhm.
And most of the stuff that we hate about healthcare is actually the healthcare system,
Yes.
right? And
Yeah.
even in my clinic, we have systems that we have to
Mhm.
follow, and it dictates how things go. Sometimes I
Yeah.
really wish it didn't, but um, uh, it's definitely not the providers. Everybody loves our providers; we're great,
So great.
yeah. But some of the rules and everything like that, it's like
Mhm.
ugh. So
Mhm.
let's see. A red flag for me. Um, I think if I hear back that a provider will not touch a patient
Yeah.
or will not do an examination on a
Mhm.
patient,
Mhm.
that is a red flag for me.
Mhm.
Especially when I have somebody who comes in and they have a problem, and I'm checking them out for the problem, and we do the exam and everything like that, and then uh, I'm explaining everything, get to the part where I'm like, "Do you have any questions?" And they're like, "Nobody's ever asked me all those questions. Nobody's ever
Mhm.
done all those exams. Like nobody's ever
Yeah.
like tried to do those tests and things like that." So I felt like this is really pretty thorough. And I'm thinking back and I'm like, gosh, I felt like I skipped over some stuff.
Right.
And I
Yeah.
don't do super long
Mm-mm.
exams. It's
Mhm.
like a new patient appointment. It's like 40 minutes or something
Mhm.
like that.
Mhm.
But it really like at that point, I will look back at who have they told me their providers are, and I
Yes.
just put a little check mark
Mhm.
next to them, and I know that this provider is not doing real exams on patients.
Mhm.
Bet you anything they're billing for them, but
Yes.
that's an issue. That's a red flag
Mhm.
for me.
Mhm.
Yeah. Do
I
you
had
have
a
any others?
Yeah, well, I had a professor in PT school. This is our MSK professor, um, partnered with, Amy McDivitt. I just like to drop her name,
We love Amy.
Love
Hey,
her.
what's up,
What's
Amy?
up, Amy? I'm sure she's
What's up,
listening.
AIM dog? Fellow Amy.
He announced the beginning of the semester. He said, "Look, I'm gonna give you the answer to this
Mhm.
exam question." And he said, "When a patient says, I have pain when I go up and down stairs, I'm gonna ask you this question. What test should you do if the patient comes in and says, I have pain when I go upstairs? The answer will be, watch them go upstairs."
Ding ding ding.
That's the answer.
It's highly technical.
If your provider does not see you do the thing, like it hurts when I raise my arm up like that. If they don't watch you do
Mhm.
that, that's a red flag for me.
Okay.
Yes.
Yeah, that's you gotta connect the dots to where the patient lives, like
Yes.
what the patient is actually
Yes.
going through.
Because people will be doing some funky things.
Mhm.
And it's really easy to figure out what's going on
Yeah.
when you watch them do the thing that hurts.
Yeah. Yeah. Um, and I think that there's also some obvious ones like y- providers who don't take time with patients,
Yeah.
right?
Yeah.
Make them feel rushed, like
Mhm.
hurried out the
Mhm.
door. Providers who are rude
Mm.
to
Yep.
patients, they talk down to them, demean
Yes.
them. Um, I, I hope I've heard it all, but I feel like I've heard it all. Like doctors who will call their patient fat. And
Yeah. Right.
granted, this is coming through the
Right.
filter of the patient,
Right.
right? So
Right.
we don't
Mhm.
know. Some patients sometimes you're not very reliable either.
That's true.
But but it's just not good when any provider makes people feel like that.
Mhm.
And being a doctor, being a therapist, any of those kinds of things, it is stressful. There's a lot like um I had a patient this week, really acute low back pain. And like I'm not a rush to x-rays guy, but this is an
Yeah.
x-ray first visit
Yeah.
guy. So we send it off, goes gets the x-rays. I get the X-ray report emailed back to me,
Mm-hmm.
and I look at it. And when you get an X-ray report, it'll tell you what's happening at every level, all the
Mm-hmm.
stuff that you'd expect to see.
Mm-hmm.
Hey, at L1, we saw this.
Mm-hmm.
Okay. So what I was expecting to be there was there. And it was the only thing that was there, which was moderate decrease in disc height, meaning these two
Yeah.
vertebrae are a little closer than they should be,
Right.
which could be an indication that somebody has a herniated disc. And
Mm-hmm.
so I was like, yes, this is what I was looking for. No other findings. Okay. Then there's a part at the bottom called the clinical
Yeah.
impression, where they summarize all those findings and say what it means, and they make some suggestions as to like what's the next step. Number 1, acute fracture or dislocation. I was like,
What?
wait, what? So I go back up and I'm like, where is it?
Yeah.
Where is it? Yeah. And then number 2 was moderate disc, moderate loss of disc height. And I was like, wait, okay. So I see that one, but where's the acute fracture dislocation? So I get on the phone right away and I call up the imaging center and I'm like, I need to speak to this radiologist. And I get on the phone and I was like, hey, you read this person's film and, and I had a question. And he's like, hang on a second. And he looks, no. And I was like, no? He said, yeah. He's like, it's a typo. I missed the word no. And I was like, okay, yeah. So no acute. Yeah, he's like, I understand why you freaked out. And he's like, I'm sorry.
Okay.
And then he told me the thing that shocked me. He said, he's like, when you called, I am on my 145th read of the day.
Wow.
Yeah, this is at 4 p.m.
This is the system we're talking
He had
about.
seen 148 films that day. And I was like, that's incredible. That's more people than I see in a week.
Oh, yeah.
Yeah. And so I think sometimes it's important to understand that, especially in our healthcare system, there's a lot of stress.
Wow.
There's a lot of places that are understaffed.
He had to write up 148 reports
and
that day?
He missed 2 letters.
Wow.
2 letters.
Critical letters.
So yeah, I don't fault him at all. And I've gotten many reports from this doctor, and he's really good. But I think sometimes when you're dealing with your provider, have a little grace. The day I found out that my mom had terminal cancer, I saw patients.
Yeah.
Right? I don't know that I did my best work that day.
Yeah.
But you got to show up and try and help people. So, maybe sometimes if somebody does a really crappy job, maybe you give them another chance.
Give them grace.
If they do a bad job the second time, write that Google.
They've showed you who they are.
So.
Yeah.
And then what about this? What if somebody is good at their job? They've got the certifications and all those kinds of things. But what if they just aren't a good fit?
Yeah.
Like, what kind of advice would you give a patient who they aren't vibing with their provider?
Yeah. You can ask. You can ask to be referred to someone else.
Yeah.
Or you can just, you can politely end your care with that provider and just say, thank you, but I feel like our care here is done. You don't even have to tell them you're moving on to another provider.
No.
You can leave.
Yeah.
It's still America.
Yes. Well, sometimes we record these episodes like a week or so in advance, and we're just not going to make any guarantees. But as of this recording, this is still America. Okay.
We'll update you.
Yeah. Whew.
Next week.
Yeah. Boy, it's going to be funny if this comes out and it's like, well, who wants to tell them?
This didn't age well.
Yeah. But that's a really good point.
Yeah.
And I think it's so uncomfortable. It's so uncomfortable because it is a relationship of trust, and it is trust that is almost, I mean, let's be honest, it is mostly on the part of the patient.
Yeah.
That they have to exhibit some trust, right? You go to see your doctor, and the doctor might ask you to get in a gown. You don't get to ask the doctor to get in a gown. Okay? It's like, I'm going to need you to remove your shirt. All right, you first, buddy. No, that doesn't happen. And if any of my patients are listening, don't try that crap on me, okay? I invented this. Don't try that crap on me. Don't ask me to take off my shirt. That'll be your last day at Body of Health. But so patients have to put a lot of trust out there. And so your trust should be rewarded I'll put it that way.
Yes.
When you're working with a
Yeah.
provider, your trust should be rewarded. You are entitled to explanations of what are we doing? Why are we doing it? What are we hoping to accomplish?
Yes.
And so that is a big deal. So I think it is okay to decide not to work with a provider. And I think most providers are going to understand, and that's okay too,
Mhm.
right?
Mhm.
The only ones who won't are probably the ones who are pretty new and they don't understand that they aren't the doctor for everybody.
Right. Right.
It it took me a while to figure that out.
Yeah.
Maybe like a year where I was like, because it felt really bad.
Yes. Yeah.
Like sometimes people just wouldn't come back, or they're like,
Mhm.
I don't really like your style or
Mhm.
whatever. And it's just really easy to take that personally. And I don't think that I understood that there's going to be other patients.
Yeah.
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 Patients that I like more.
I think too, as the patient, if when you go to that first visit, you can ask the questions. I like this when patients ask me, and I should just be offering this anyway, but some of the people that will ask me like, okay, how do you see me progressing? When should I feel better? When should I notice, less pain? When should I be walking better? Those kind of
Hmm.
things are really good questions to ask, and your provider should be able to give an educated guess. They can't
Yes.
be, they're not always going to be 100% correct. And
No.
and I actually made a really big mistake with a patient that we shared.
Hmm.
And I told her, I was like, after my first exam, I was just feeling confident. I was like, you know what? I think you're gonna, I just thought it was like this flare up, and it was a musculoskeletal thing that we are gonna be able to get taken care of in a month. And that month came and went.
Oh boy.
And
Yeah.
went,
Yeah.
and went, and she every time she would come in, after 2 months,
Hmm.
3 months, she's like, "A month, huh?
Yeah.
A
How's this
month.
month?
How's
How
this
long is
month
this
going? Boy,
month?
this is
Yeah.
a really long month."
Yeah.
So, yeah, sometimes I'm wrong,
Yeah.
but if I feel like, a lot of times I'll be like, "I've seen this
Boy, Kathy,
before."
I'm going to be going home and replaying this over in a loop. Sometimes I'm wrong. Sometimes I'm wrong. Sometimes I'm wrong. Sometimes I'm wrong. Oh, what a
Yeah,
gift.
so
Jeez.
anyway, yep, that
Yeah,
was
but
good.
it's
Mhm,
totally true. I
mhm,
mean, I alluded to it in the beginning, but we are not
yeah.
psychic,
No,
right? We're not. And
right.
sometimes, well, the process of healthcare is a series of educated guesses,
Mhm,
which is why it requires so much education to
mhm.
get into healthcare.
Yes.
If you want to make uneducated guesses, you can go on the Joe Rogan show. You could have the JRE. No, just so yeah, a lot of shots fired at Mr.
Yeah,
Rogan the last couple weeks.
yeah.
Um, but yeah, I mean, it's the communication is really
Mhm,
the key.
mhm.
And I think that there's kind of a rule of thumb, and I say rule of thumb, but there's actually some research that supports this. But 6 visits,
Yeah.
4 to 6 visits is
Mhm.
about when you should see some sort of appreciable
Right.
change if you are barking up the right tree.
Mhm.
And so if you've been going to somebody for 4 to 6 visits, whether it's a PT, chiropractor, orthopedic surgeon, whoever it is, in 4 to 6 visits, you should notice some sort of a change. And if you don't, it's okay to say, hey, listen, we've been doing this for a
Yeah.
minute now, and I'm not seeing much of a difference. And that's not just an automatic sign that you should give up
Right.
or that the doctor should give up or whatever, but it is an indicator that it's maybe time to try a different
Yep.
approach, whether
Change.
that is with a different provider
Mhm.
or we're trying a different technique
Mhm.
or we're seeing you left off less often or more often. 4 to 6 visits is kind of that period where you should, not saying that your problem should be totally resolved or mostly
Right.
resolved, but you should see some progress by then. And I think that that's fair. I've been looking at a lot of research lately, and actually, kind of the sweet spot. I was talking to Lily, and I was like, I don't think that we do evidence-based practice here, and she's like, why? I was like, well,
What?
because I've been looking at research, and the there's the most efficacy in
Mm.
these studies for chiropractic treatment plans that are about 12 visits.
Yes.
And
It's 10 in PT.
it's 10.
Just
Okay, yeah,
saying,
yeah,
we get it
okay.
done in 10.
Well, that's why I'm telling her that we're probably not doing evidence practice because we're coming in at about 7. We
Whoa.
actually track it. So,
Okay.
yeah, I would be an excellent PT.
You would. Be
So,
crushing it.
But it's an interesting thing because it's like, oh wow, that's what the evidence says.
Mhm.
It's about 12 visits. And so I don't know if I'm setting people's expectations right. It's like,
Right.
man, maybe I should be telling
Mhm.
people it's going to be about 12 visits.
Mhm.
And then how you get there is like twice a week for 6
Right.
weeks or once a week for 12 weeks. I
Mhm.
don't know. But
Yeah.
yeah, interesting stuff.
I think it's a legit question you can ask your physician too when they prescribe you a med.
Mhm.
Like, when am I going to feel a change from? When should I feel a change from this med?
Yeah.
Because you're not going to see that physician
Yeah.
for 6 months.
Yeah.
So
Mhm.
if you keep blindly taking these meds and you're not seeing a change, like you should know, like to check back in. Like they should be able to give you an answer. Like, yeah, if you don't feel anything changing in 6 weeks, because some meds take a while.
Yeah.
Like, antidepressants, you got to take it for 6 weeks before you're going to start to feel a change. Like,
Mhm.
that's a legit question to ask.
Yeah. And what if they can't give you an answer
Yeah.
or they don't want to give you an
Yeah.
answer?
A good answer is still, I don't know.
Okay.
If they say, I don't know, but this is what research has said, that's a good answer.
Yeah.
If they say, if they say, I don't know, and then they don't follow it up with,
Mhm. Oh, I don't know.
I don't know.
Yeah.
Oh.
Uh-huh. Who knows? Why would I know that?
And here's some peptides to inject.
Yeah, right. Let's get you on the Wolverine stack. Yeah, and I think just in general, that's another flag that you look for is how do they respond to any question that you ask them?
Yeah.
Like,
Good
is this
point.
really necessary? What are my options? Oh, that's a big one. You have
Yeah.
a right
Yes.
as a patient to understand what are the risks,
Mhm.
what are the benefits,
Mhm.
what are the alternatives? What happens if you do nothing, right? Okay, you gave me your treatment plan for taking care of my foot fungus. What if I just decide not to do anything,
Mhm.
right? They are required to let you know that information so that you can make decisions. That's called informed consent. So, a doctor or a provider that you don't feel like is contributing significantly to you having informed consent, which is not just a piece of paper that you sign in the beginning. If you're just like, oh, you signed the informed consent, so I don't need to tell you anything. Yeah, skip that person, right? And they will figure it out when they see a significant number of people leaving because everybody listens to this podcast and they will now know, yeah, that is not okay. That's a huge red flag.
Yes.
Yeah. So, I think anytime if you feel like somebody is really trying to sell you something,
Yeah.
and by sell you something, I mean like financially sell you
Mhm.
something, which
Mhm.
chiropractors, like, we're guilty of
Yeah.
this. There's entire seminars on how do you do an effective review of findings, which when you see that, it's like,
Mm.
do you mean like an actual review of findings where it's like, I'm telling you what's wrong with you,
Mhm.
getting informed consent and we're treating?
Mhm.
Or do you mean the review of findings where I'm trying to sell you 24 visits, which we
Yeah.
know is not evidence-based?
No. It's 12.
Yeah, it's just 12, guys. Um, so that's another flag. If you feel like you're being sold something, if they're trying to corner you into a treatment, then you probably want to see what happens when you get out of that corner.
Mhm.
There's probably some other corners in the room
Mhm.
that you can be in. Now, there's sometimes though when you're having a serious conversation, it's like these are your options, and it's kind of limited. Like I had a patient who came in very high blood pressure. And I was like, dude, I'm going to do everything that I can for you today. I am not going to adjust you. I'm not going to be able to
Yeah.
because I'm concerned about your safety. Your back pain, your neck
Mhm.
pain is not the biggest problem that you have right now. It is your blood
Mm.
pressure. Right. And that patient got upset.
Mm.
And I totally get it. I
Yeah.
understand. I did everything that I could, but I understand that he was upset. Uh, and I told him, your option is you have to go to the hospital. Right.
Yeah.
So that's not me trying to put him in a corner. That's
Right.
me trying to help him understand this is the
Mhm.
very best thing
Mhm.
that anybody could do for you right now is let's get your blood pressure taken
Mhm.
care of. So, but that's not me saying, listen, your blood pressure is really high. The very best thing that you could do is buy this package of 24 visits. And I've actually got a few large bottles of supplements, and I know they're expensive. It's $400 for one bottle of supplements, but if you buy it today, you get a second one for half off. So that's what it looks like. That's what it looks like.
That is a red flag.
Yeah, or a surgeon, in
Mhm.
like medicine, a
Mhm.
surgeon who tells you your only option is surgery. might be your best option.
Sure.
Legitimately could
Could
be your
be.
best option.
Yeah.
But is it your only option? No, surgery's not required.
Never.
Yeah. And it's not free.
No.
Yeah. So yeah, those are the things.
Mhm.
Can we do a couple of these? I wanted to
Yeah, let's do it.
and then we'll get to the game,
Mhm.
which I feel like is kind of similar. You see where I'm at, where it's like the questions that you ask. So
Yes.
it's a green flag and a
Mhm.
red flag.
Mhm.
So how about this? Read the question, you give us the green flag, and then I'll
Okay.
give the red
Sounds
flag. Okay.
good.
So first one, when the patient says, "What do you think is going on, and how confident are you in this assessment?" What's the
Yes.
green flag?
Green flag is a nuanced answer with differential diagnosis and percentage of confidence.
Yeah. So we're like 90% sure, right?
Mhm.
Red flag is immediate certainty. Like, oh, I know exactly what's going on with you. And definite answer without an exam.
Yeah.
We haven't touched you. We
No,
haven't looked at
we
you.
don't
We've done
know.
no tests, but
We don't know.
I can already tell. I could tell when you walked in. You've got kidney stones. Your kidney stones have kidney stones. All right. What about this? When you ask, what does progress look like? How will we measure it?
Good question.
Green flags.
Specific metrics, timeline expectations. By visit 3-4, we should see this happening.
Okay.
X.
And a red flag is a vague, you'll feel better
It'll be all right.
sometime.
Give her time.
Yeah. How many visits you got on your policy?
Yeah, exactly.
Oh, speaking of
Let me
which,
check your policy first.
speaking of which, how many visits do you think this will take?
The green flag is a range with explanation of variables.
Okay, and the red flag is hard to say, and there's no follow up. Or let me sell you a 24 visit package, and we're not going to examine you, and I'm not going to tell you when or if you're going to feel better. It's just, but you're going to get those visits, and you're going to know that you're better.
That 24th visit, you will probably be feeling much
like you need to
better.
buy a new 24 visit package here at Naughty of Hell. No, okay. What about would you make or what would make you refer me to somebody else? What a great question, right? At what
really
point,
good question.
yeah, at what point do you think I need to be referred out? Green flag.
Green flag, specific scenario, seems comfortable with the idea of referring out.
And then the red flag is, oh no, I got this. I can trust me, I can handle everything. Right. Or they're like, well, you're talking about leaving? Yeah, don't leave.
You'll
right.
never find any better than me.
All right, one more. What about what should I be doing in between visits?
Green flag is home exercises, activity modification, self-management, education, yada yada.
And yeah, and then the red flag is like you should be thinking about when you're coming back next, right?
Just rest.
Yeah, should be getting a loan
Only I
to cover the cost of your care.
Only I can cure you.
Yeah, or if they tell you just rest, don't do anything.
Mm-hmm.
Like you're fragile.
Red flag.
Yeah, you're broken.
Red flag,
right.
Red flag.
So that is kind of a recipe for dependency.
Yeah.
So this kind of brings us to our game.
Okay,
Can we play a game? I think we're gonna throw it to Raul over in the booth. Raul, what you got for us?
Hello, everyone. Okay, so today, basically what y'all were already kind of starting to do is I'm going to give you some situations. You're going into an appointment, and this is the scenario in front of you, okay? And then y'all get to discuss whether it's a red flag, yellow flag, actually okay, or you could even do like, I don't know, beige flag. Have you heard of that one?
Beige flag?
Yeah, beige flag. That one's like, it's like not wrong, but just weird.
A weird flag.
Right? Yeah.
Okay.
Yes,
Just like
okay.
weird. Yeah. Okay. So here's the first one. Actually, some of these y'all have already kind of talked about. First one is essential oil diffuser in the treatment room.
No, that's a giant beige flag. Giant beige flag for me. Which one? What does beige mean again?
Beige is like weird, but not necessarily problematic.
Yeah, I'd go yellow.
Yeah.
Yellow, reddish.
I'll stand by beige. Yeah. And here's what I think. It depends upon what you're diffusing.
Yes, there's that.
If you're diffusing patchouli, like freaking gross, first of all. Second, well, listen, you dirty hippie. No. Well, but patchouli actually is a good example because there happens to be a lot of people that are very sensitive to patchouli, common allergen.
Yes.
And so that to me says a doctor who may not be thinking about who's coming into the room.
Yes.
There are some other things though that if they're being diffused, it actually could be like pretty helpful. Like so maybe if it's flu and allergy season, if they're hitting a little eucalyptus or something like that. But yeah. And people like sometimes I'll be talking to people online and I'm like, oh, I'm an evidence-based chiropractor, blah, blah, blah. And then they're like, let me check out your website. And they go to the website and they're like, oh, they sell essential oils. And they're like, you're a quack because of essential oils. And it's like, all right, well, do this. Go to PubMed, look up essential oils, see if there's any evidence out there. Now, I'll just have you know, like the only thing I do with essential oils is I sell them. I don't ever talk to patients about them, but like we've got them and people want them. So it's like, cool. We sell very little, but yeah, there's evidence behind essential oils, but I think that just from that comfort and thinking about the patient standpoint,
I would agree.
I'll go yellow instead of beige.
Yeah.
How about that?
Let's go yellow light.
All right.
Awesome. Okay, so next one we got. This one's kind of similar. A little bit different though, I think, along with what y'all were saying. Crystals on the desk.
Well, it depends. Sometimes patients give me gifts and I leave them on the desk.
Okay.
So
I have a couple huge crystals in my treatment room.
Yeah.
Those are from my mom.
Oh,
yeah, she had them.
see?
And so, yeah, she's a part of the clinic.
Yeah.
Now, if it's crystal meth, a green flag. Green means go.
Green, let's
let's go. All right. Is it that chili pea? You know, that's right.
No.
Chili pea.
No.
Yeah, it's Breaking Bad, right?
No.
It's Jesse Pinkman's special, the chili pea. It's got a little chili powder in it. Right. All right.
Okay, next one we got a skeleton model wearing a funny hat.
Did you see that in our clinic?
Oh, is that? Oh, yeah. I think it's a giant green flag.
Yeah.
Yeah, it's my kind of place.
Yeah, people like to have fun.
Yeah, right.
Yeah.
And I think it makes you approachable. It takes something that's potentially intimidating and lets you know that hey, we're not too scared of the human body and everything like that. I like it.
Yeah, we're gonna explain to you
Let's go
what's
green.
going on. Green.
I like that. Okay. Next one we got. Your provider checks their phone during your visit.
Ooh.
Oh, that's a hot pink for me.
Yeah.
It depends upon what kind of provider it is. Because if it's somebody who could be having an emergency, then okay, that's cool. But no, when you're in the room, be in the room with me.
Yeah, it's pretty red.
Yeah,
Pretty red for me.
Okay, next one. This is in quotes. I can crack your neck without touching it.
Oh.
What are the letters after the name?
PT or DC?
Yeah.
Doesn't specify.
I can't crack your neck without touching it. I don't recommend that any chiropractor use that terminology.
No.
Cracking.
That's red.
Necks. And I know that there's a lot to do. There's a lot to disagree with me. But when Bobby was here, Bobby Maybe, and he talked about your instruments and how you handle your instruments, I see the adjustment as one of my instruments. And so I always refer to it respectfully.
Yeah.
If you are a member of my family and like we're together and it's a holiday or something like that, and you're like, hey, Jason, can you crack my back? I will just stare at you until you use some different terminology. And I've made some people uncomfortable because they're like, what's wrong with him?
Yeah.
Like, oh, I need you to crack right here. I don't respond because Raul will crack your back. I will adjust you.
Yes.
Right. No disrespect, Raul.
No.
But yeah, cracking is for people that do not have the training. So
yeah.
I think that's a great explanation. Next one, also one that y'all kind of talked about already. Supplements are for sale in the lobby.
I don't think that's yellow. It's yellow because there are some reputable supplement companies out there. And there are some supplements that are beneficial for people.
Totally. I think it's how you deploy that. Right. If it's first of all, the brand matters to me. If you listened last week, and I think it's a red flag if you see a clinic that is engaging in multi-level marketing for supplements. Because then you're mixing a business relationship with a doctor-patient relationship, and it's hardly ethical.
Yeah.
So
nice. Okay. Well, not nice. Okay, next one. The provider says, I've never seen a case like this before.
That's green for me.
Yeah.
Yeah.
It's honesty. Yeah, I mean, there's times that you're just like, this is a first for me.
Mm-hmm.
Yeah,
Yeah.
yeah.
And you should appreciate the honesty because the next thing that follows is going to tell you
Yeah.
whether that's going to be a good relationship or not.
Mhm.
I've never seen this before, but here's exactly what we're going to do.
Yes.
That's when it gets a little
That's
red.
red flag.
I've never seen this before, but I'm going to do some homework. I'm
Mhm.
going to ask around. I'm going to find some people who have experience with
Right.
this. And we're either going to get you over to see them or I'm going to have them help me know what's going to be the best
Mhm.
for you.
Yep.
Lots of good answers. Oh, what's happening? Okay, there we go.
How many?
Okay.
Who has the most points?
I don't know if this is a point
You
one.
keep
Pro- it's
taking
pro-
all the
It's
answers.
probably Kathy.
Okay, next one is absolutely no wait time ever.
I can get you in 5 minutes.
Yeah, they're either very fast, very new,
Very
or
new. Yeah.
or
Or there's a reason you can get
yeah,
in.
it's like eating at the empty restaurant.
Yes.
And then we got one last one. Oh, actually, no, a couple more. Okay. One, the provider hugs you goodbye.
Oh heck no. Mm-mm. No, 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 no. It's a hard no for me. Yeah. The issue here is there's a couple. Number one, what happens if somebody sees you hugging a patient? Like, how does it make other patients feel? Especially if they don't get hugs,
Mm.
right? And they have to wonder what happened in that room, what's happening between those people. If it's a family member and I hug them goodbye, that's easy. They're like, I tell them if they see me hugging somebody and it's a family member, I said, that's my sister, right? That's my lawyer. No, my daughter's gonna be a lawyer. So, but
Find
yeah,
a lawyer.
and also the message that it sends to patients is not good. It's a ethical boundaries overstep. I don't like it. Do you guys hug everybody at at Encore?
I'm a hugger.
Yeah.
Yeah.
Mhm.
So, boy, this is our first disagreement. Probably.
Is it? Okay,
Yeah,
all right,
Like
yes.
hardcore disagreement.
Okay.
Yeah.
All right.
I'm a spiritual person.
Mm-hmm.
There is obviously there's some boundaries that you have to hold, but when someone's just so excited
Mm-hmm.
that to see you and that you helped them feel better, whether physically or emotionally, just sometimes people just come in to get stuff off of their chest.
Finally, this is the conflict we've been looking for.
Yes, this is
Yeah.
it. Thanks for listening. Can I give you a hug? And I say yes.
Do you think it's different for men and women?
Yeah.
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 Okay.
People want.
Yeah.
Maybe I'm just more huggable than you. People ask me all
well,
the
it's
time.
easier to fit.
Can I hug you?
It's
and
easier
I say
to
yes.
fit arms around you than it is around me.
They usually ask, "Can I
Yeah.
hug you?"
Uh-huh.
So
Okay.
yes.
That's good.
Yeah,
Well, you're
I
healing
don't
through the power of
initiate the
touch.
hug first.
Yeah.
It's a red flag.
You're like, that's all the time we have for today. Oh, wait, where are you going? Get over here.
No,
Get in here.
Nobody leaves without a hug.
How are you going to get better? How are you going to get better?
Nobody leaves without a hug or doing squats.
Yeah, uh-huh. Yeah, give me one right here. Look, just a little smidge right here. Raul, get us to the next one.
Okay, next one. Your provider calls it a healing journey.
Oh, pass. Yee.
Yeah.
Yeah. I don't know.
Yes.
To each their own.
Yes.
I think that there's a way
It's
to do that
pink.
and it's just
pink.
fine.
It's pink.
I
for
don't
me.
know. It's just, yeah. It's like, I don't think that it's anything bad. I would never say, oh, they called it a healing journey and that's bad. It's just sometimes it's weird, you
That's
know?
weird. Yeah.
But some people, it's what they want. It's what they came to you for a
Yeah.
healing journey.
Yeah.
Don't come to me for a healing journey, I guess.
Well, there you go.
It just sounds like something you put on Instagram.
Yeah.
Come with me as I take you on a healing journey. No.
Maybe you need a
don't
healing
know.
journey.
Yeah, it's not bad. I'll give it a green. I'm feeling generous.
Wow.
You get a green light for a healing journey.
All right.
Yeah.
Okay, and then we have one last one, and that's you walk in and there's a testimonial wall with celebrity photos.
I've seen those.
Yes. I kind of have one a little bit.
You do?
Yeah, my beaver dam. Yeah, and that's
Oh,
because Mandy was like, you know what? Nobody's going to believe that you actually work on players unless you get some pictures of
there
players
is
on the
that.
wall. And so it's like I have a few things up.
Mm-hmm.
I feel weird about it though.
Mm.
Yeah, I don't know. What's your take?
I think the celebrity can lend credibility,
Definitely.
but also you hope that that celebrity did well.
Yeah.
And
Oh, yeah. Yeah. Oh, yeah. This is I used to treat Aaron Hernandez. No.
Exactly.
Oh, yeah. Double murder? Aaron
Exactly.
Hernandez?
Yeah.
Yeah. Oh, this is me and OJ Simpson.
Yeah.
Yeah, look.
Mm-hmm.
Jeez Louise. Yeah, here's the jail
I
bill.
think it's risky,
It can
but
be.
I think it lends credibility. It's also can feel a little boastful.
It does, yeah. Well, and you hope that those celebrities have a signed HIPAA form
Yes, of
on
course.
file,
Yes.
so that
Yeah.
so that it's okay that you're displaying that this is a patient of mine. But yeah, I think that kind of swings both ways. And I know some very good doctors. I'm not talking about myself.
Right.
I know some very good doctors that have impressive celebrity walls,
Mm-hmm.
like our friends at Beaver Sports Medicine. Yeah.
Mm-hmm.
They have tons of
Yeah.
like memorabilia from patients and things like
Yeah.
that. So yeah, it's kind of cool.
Yeah.
But there's some doctors that just get such a big head about it. It's like, blech. All right. Anyhow. All right. I think we're way over time.
Way
Way over time.
longest
Nobody's
episode
listening.
now.
Yeah. Everybody who was listening to this in their car is now in another state.
Amy's listening.
Yeah.
She has that long drive
Right.
from
Yeah. Oh,
LC.
yes. That's
so.
that's true. That's
Hi, Amy.
true. Yeah. She might be in the ocean now,
What's up,
though.
Clemmy?
So we got to land this
Yes,
plane.
we do.
All right.
Okay.
Take homes.
Take homes. It's kind of where I started. You know what you're looking for in a healthcare provider when you seek one out.
Yeah. My take home is I guess I have to start hugging more people.
Don't initiate it.
Yeah. Oh, okay. Yeah.
They'll ask.
New policy.
They will ask, can I give
Yes.
you a hug?
With every hug, you get a free bottle.
Buy one, get one. free.
Buy one, get
Must
one free
buy
bottle.
one of these
Yes.
essential oils, and I will
Yeah.
give you a hug.
Yes, exactly. Exactly. How about this? If I'm burning incense in the room, I want a hug. No. No, I think the big thing, if I could reiterate something, it's advocate for yourself. You have a very important part to play in the quality of your visit, and your provider will understand. You are doing a few doctor's visits.
Mhm.
Your doctor does many, many. And so you can give feedback and share concerns and things like that. And chances are things are going to go just fine.
Yep.
All right. We love you all.
We do.
And there's one more thing. There's no I in pitch.